most significant immediate threat to a patient with a soft tissue injury is a nerve damage, B. Infection, C. Disfigurement, D. Hemorrhage, D. The skin is also referred to as the A. Melanin, B. Integument, C. Epithelium, D. Collagen, B. All of the following are functions of the skin, except A. Providing the immune response for the body, B. Protecting the underlying tissue from injury, C. Sensing changes in the external environment, D. Assisting in the regulation of body temperature. A. A. Blank is a fibrous protein that gives the skin high resistance to breakage under mechanical stress. A fibrin, B. Elastin, C. Collagen, D. Melanin. C. B. D. B. Which of the following substances is produced in the dermis and keeps the skin supple so that it doesn't crack? A. Sebum, B. Elastin, C. Collagen, D. Ground substance. A. C. C. B. D. B. A. Which of the following conditions or factors would most likely delay or impair healing of a wound? A. Diabetes, B. Obesity, C. Alcohol use, D. Hypertension. A. A patient taking blank would most likely experience a delay in the healing of a wound. A. Antidepressants, B. Acetaminophen, C. Antihypertensives, D. Corticosteroids. D. A wound is at highest risk for infection if A. The patient uses an antibacterial spray, B. It occurs to any part of the facial area, C. It is caused by a human or animal bite, D. The patient has poor peripheral circulation. C. Which of the following patients is at highest risk for a pressure injury? A. An obese patient, B. A bedridden patient, C. A hypertensive patient, D. A patient with diabetes. B. Which of the following wounds usually requires substantial irrigation and debridement prior to closure? A. Deep gloving injuries, B. Jagged lacerations, C. Any wound to the face, D. Wounds over tension lines. A. Which of the following is the most common cause of necrotizing fasciitis? A. Fungal infection, B. Clostridium tetani, C. Hemolytic streptococci, D. Clostridium perfringens. C. Systemic signs of infection secondary to a soft tissue injury include A. Erythema, B. Pus drainage, C. Fever and chills, D. Lymphangitis. C. Necrosis of tissue caused by an anaerobic, toxin-producing bacterium is called a tetanus, B. Gangrene, C. Fasciitis, D. Lymphedema. B. An infection characterized by painful muscle contractions is called a pertussis, B. Polio, C. Rabies, D. Tetanus. D. The swelling that occurs in conjunction with a contusion is caused by A. Inflammation of the injured blood vessels. B. Rupture of large blood vessels in the dermis. C. Aggregation of platelets to the injured site. D. Leakage of fluid into spaces between the cells. D. In contrast to a contusion, a hematoma is A. Accompanied by ecchymosis. B. Caused by large vessel damage. C. Rarely accompanied by bruise. D. A less significant closed injury. B. Whether the contamination from an open wound produces infection depends mostly on A. How the wound is managed. B. The location of the wound. C. The patient's medical history. D. How large the open wound is. A. A patient with nerve compromise following an open injury to the hand, A. should be given analgesia for the pain. B. Will likely lose all neurologic function. C. Requires prompt transport to the hospital. D. Will not be able to move his or her hand. C. Compared to the bleeding from an open wound, bleeding from a closed wound, A. is limited because the skin is unbroken. B. generally requires surgical intervention. C. is not significant enough to produce shock. D. can usually be controlled with direct pressure. A. Primary treatment in the pre-hospital setting for an abrasion involves A. administering a narcotic analgesic. B. applying an antibiotic ointment or cream. C. covering it lightly with a sterile dressing. D. thoroughly cleaning it to prevent infection. C. B. In addition to bleeding and contamination, the principal danger associated with an avulsion is A. undetectable internal damage. B. disfigurement due to severe scarring. C. invasion of the wound with Clostridium tetani. D. a loss of blood supply to the avulsed flap. D. D. C. When muscles are crushed beyond repair, tissue necrosis develops and causes the release of harmful products. This process is called a rhabdomyolysis. B. Miclobinuria. C. Hyperphosphatemia. D. Necrotizing fasciitis. A. B. A. Signs and symptoms of compartment syndrome include all of the following: EXCEPT, a pressure. B. Erythema. C. Paresthesia. D. Passive stretch pain. B. The bite from a blank poses the greatest risk for serious infection. A. Cat. B. Dog. C. Raccoon. D. Human. D. The first aspect to address in any patient with a soft tissue injury is A. bleeding. B. Ear safety. C. Airway patency. D. Decontamination. B. Which of the following medications would most likely interfere with hemostasis? A. Paxil. B. Percrit. C. Plavix. D. Tylenol. C. Which of the following interventions encourages drainage from the site of a closed wound and reduces swelling? A. Elevation. B. Splinting. C. Firm compression. D. Application of ice. A. A. If your patient has an open wound in which there is a risk of air being drawn into the vasculature, you should A. Cover the wound with an occlusive dressing. B. Cover the wound with a hemostatic agent. C. Apply direct pressure with moist dressings. D. Transport quickly to a hyperbaric chamber. A. The use of wet dressings in the field is limited because their use may result in severe hypothermia. B. They are of no value in providing pain relief. C. Their sterility cannot be maintained in the field. D. They provide a medium for pathogens to grow. D. Which of the following bandages is associated with the highest risk of blood flow compromise? A. Roller bandages. B. Elastic bandages. C. Triangular bandages. D. Non-absorbent bandages. B. Applying direct pressure to a bleeding wound stops the flow of blood because a pressure stimulates the release of fibrin. B. Direct pressure facilitates vasoconstriction. C. It allows platelets to seal the vascular walls. D. Pressure shunts blood away from the injury. C. B. D. When caring for an amputated body part, a early notification of the hospital is important. B. The body part should be kept at room temperature. C. The part should be tightly wrapped in a dry dressing. D. Applying ice to the body part will keep the cells viable. A. C. When applying a dressing and bandage to a scalp wound, you should carefully assess the skull for an underlying fracture. B. Remove any foreign particles from the wound first. C. Always use a loose dressing to soak up the blood. D. Apply a cervical collar in case the C-spine is injured. A. Your main concern when caring for a patient with a soft tissue injury to the face should be A. Airway compromise. B. Hypovolemic shock. C. Injuries to the eyes. D. Preventing contamination. A. D. B. Renal failure, a key complication of Crush syndrome, can be prevented by A. Administering calcium chloride. B. Giving 40 milliliters per kilogram of lactated ringers. C. Giving the patient 25 grams of glucose. D. Aggressively infusing normal saline. D. A 63-year-old diabetic woman presents with an open wound to her forearm that she experienced when she fell a week ago. She tells you that the wound has been draining purulent fluid, but has not been bleeding. The wound itself is red, inflamed, and warm to the touch. You should C. A 30-year-old man presents with jaw and neck stiffness and fever. During your assessment, he tells you that he cut his hand on a piece of metal about a week ago. You should be most suspicious that this patient has A. Tetanus. B. Meningitis. C. A viral infection. D. Staph infection. A. A. D. B. C. A. C. D.